Hello again to those of you who follow our press briefing live on Facebook and Twitter. Thank you very much for joining us today, the WHO European press briefing on the COVID-19 situation in the WHO European region. It's Thursday, 1st of July. I'm Luba Negru, and I'm part of the WHO Europe's press briefing team today, and will be helping with the moderation. We have an hour for the briefing, and we'll start with a short statement, as usual, and we'll leave a lot of space to your questions today. There will be one questions and, if needed, a follow-up on the first round, and then we'll go for a second round of questions if time allows. In our expert panel today, we have, as always, Dr. Hans Kluge, WHO Regional Director for Europe. Thank you, Dr. Kluge. We have Dr. Catherine Smallwood, COVID-19 Incident Manager in the WHO Health Emergencies Program. Thank you, Dr. Smallwood. And online, Dr. Oleg Benish, Technical Officer for Vaccine Preventable Diseases and Immunization at WHO Europe. Thank you, Dr. Benish, for joining us today. Without more delay, Dr. Kluge, you have the floor for the opening statement.
Good morning, good afternoon, everyone. A 10-week decline in number of COVID-19 cases in the 53 countries in the WHO European region has come to an end. Last week, the number of cases rose by 10%, driven by increased mixing, travel, gatherings, and easing of social restrictions. This is taking place in the context of a rapidly evolving situation. A new variant of concern, the Delta variant, and in a region where, despite tremendous efforts by member states, millions remain unvaccinated. Delta overtakes Alpha very quickly through multiple and repeated introductions and is already translating into increased hospitalizations and deaths. By August, the WHO European region will be Delta dominant. But by August, the region will not be fully vaccinated. 63% of people are still waiting for their first jab. And in August, the WHO European region will still be mostly restriction-free with increasing travels and gatherings. The three conditions for a new wave of excess hospitalizations and deaths before the autumn are therefore in place. New variants, deficit in vaccine uptake, increased social mixing. And there will be a new wave in the WHO European region unless we remain disciplined, and even more so when there is much less rules in place to follow. And unless we all take the vaccine without hesitation when it is our turn. Vaccines are effective against the Delta variant. Not one dose, but 2 doses. Delays in getting vaccinated cost lives and economies. And the slower we vaccinate, the more variants will emerge. We see many countries doing well, but the truth is that the average vaccine coverage in the region is 24% only. And more serious, half of our elders and 40% of our healthcare workers are still unprotected. That is unacceptable, and that is far from the recommended 80% coverage of the adult population. With these figures, nowhere is the pandemic over, and it would be very wrong for anyone, citizen and policymakers, to assume that it is. Today, I am not here to cold shower any Euro 2020 fan or anyone's holidays. But before we watch our players, and before we all pack and go for some well-deserved rest near home or far away, it is my imperative to give 3 messages. First, if you decide to travel and gather, assess the risks carefully and do it safely, keeping all life-saving reflexes of masks and self-protections, especially indoor and in crowds. Second, take the jab. Don't think twice, take it, for you and for the others. And third, bring the vaccines to our most vulnerable ones first. COVID-19's trajectory in the coming weeks and months, whether we are to see a resurgence, whether schools are able to open their doors for our children, depends on the decisions and actions of us as individuals, communities, and as governments we will take now and the weeks ahead. The stakes are still high, but let us remember, solidarity pays off. Thank you.
Thank you very much, Dr. Kluge. Dear colleagues, dear journalists, the text of the statement will be posted on our website in about an hour or so. But if you need it urgently, please contact our press team in the email listed in the media invite. So now let me open the floor for the questions. And first, of course, I would like to thank those journalists who shared their questions in advance in writing. And I will start by them. First question comes from Taz Ali from the iPaper based in London. Taz would like to know, should we expect further lockdowns in Europe, and is there likely to be an autumn-winter surge? I have to say that it's one of the most frequently asked questions by the media, and I'm looking at Dr. Kluge. Dr. Kluge, can you please start answering? And then if Dr. Smallwood would like to add anything on that.
Thank you, Taz Ali. As I was mentioning in the statement, the vaccination coverage in the pan-European region is still not sufficient to protect us from a new resurgence. And remember that we have been there a year ago. So we really should learn the lessons. Of course, we are much further because we see that vaccines are working. They prevent particularly hospitalizations and deaths and in the vulnerable groups. But as I was mentioning, after 2 months of decreasing cases, now for the first time, we saw an increase in new cases of 10% during the last week, which not surprisingly is driven by increased mixing after societies are opening up and also the increased transmissibility of the Delta variant. So I would say the window of opportunity to act is now, and it depends really on our actions as individuals and communities. To put it simply, more transmission, more variants. Less transmission, less variants. Thank you.
Dr. Smallwood, anything to add?
I'd just like to add that in addition to what the regional director just said, the real question will be, what is the public health impact of a surge in cases? And that's where vaccination really comes in key here, especially in the context of Delta variant. If we have large groups of populations that have not had 2 doses of COVID-19 vaccine, the increase in cases that we're already seeing in several countries across the region will be resulting and will coincide with increasing hospitalizations and increasing deaths. So the concern, as we've been saying for months now, of an autumn resurgence is still there, but what we're seeing now is that it might even come before the autumn.
Okay. Dear panelists, actually, if you allow me, I'll make an exception. I'll just take a second question from Taz, because it also seems to be one of the most frequently asked. She wants to know, does the WHO believe holidays in Europe are safe with the use of COVID passport, or should holidays be avoided altogether? And I would like to stress that Taz is asking about Europe, not WHO European region, so probably focused on that part of our region.
So I will answer again first Taz Ali and then hand over to Katie. We do understand, of course, that people are tired of restrictions. This has been and still is a long period to adhere to the restrictions. In fact, WHO with partners launched a summer communication campaign, Summer Sense, that if you decide or think to travel, really think very carefully, and then if you decide to do it safely. Be your own risk manager and take the precautions, as we say, the 3 W's: wear the mask, wash your hands, and watch the distance, and avoid the 3 C's, the settings that are closed, confined and crowded. And as Katie was mentioning, let's all together work to scale up the vaccination. So if it's your turn, take the first jab. Still 63% of the people in the larger region are waiting for the first jab. And then if you got the first one, like I did 2 days ago, take the second one immediately when you're called upon.
Dr. Smallwood, yes, please.
Just to take this a little bit further, I think at the individual level, we all need to ask ourselves, what's the risk to myself? Who am I? What underlying health conditions might I have? Have I had my full course of vaccination? Where am I going? What's the epidemiology in the location where I'm going? What's my access to health services should I become ill? What am I going to be doing? Am I going to be frequenting areas that are crowded? Or am I going somewhere where I'm living in a small group and not coming into contact with other people and hiking in the mountains, which is a much lower risk? And also, what are the requirements that are going to be asked of me while I'm traveling? How am I getting there? What are the risks during travel? And what will I have to do when I come back home in terms of either testing or quarantine? So all of these need to be taken into account.
Sorry, Mike. The next question is from Birgit Grigo from WDR in Germany. Birgit is asking, do we need more sequencing to stop the pandemic, and why? Dr. Kluge, do you want to take this question?
Birgit, so more transmission, more variants, and vice versa. So, of course, WHO has been monitoring and measuring variants of concern since the start of the pandemic. And there are many, and I think it's important time to time to remember that most variants are not of concern. But absolutely, it is very important to beef up sequencing and study the effect on transmissibility, severity, and vaccine efficacy, so that we still better understand what does it mean really for the pandemic.
Thank you. Birgit, just to acknowledge that we still keep you 2 questions on the list. If we manage to answer this during the briefing, okay. If not, then we'll get in touch with you in writing. The next question is from Kostas Davanis from ERT in Greece. Kostas' question is, vaccinations continues in the EU, having reached 360 million doses. However, there are citizens who, either out of fear of side effects or ideology, are not vaccinated. Could you explain to us what the epidemiological situation in Europe would have been if vaccines had not been discovered and distributed so quickly? Thank you, Kostas, for this very good question. Dr. Kluge, can you start, please?
Yes. Evcharisto Pouli, Kostas. So, very straightforward here. Vaccines save lives. And I really appreciate your question, because we should not forget that there are several silver linings in this difficult time. One of it is that 18 months down the pandemic, there is a portfolio, quite a robust portfolio of vaccines which are working, which previously would take 5 to 10 years. In the European Union, there is also the joint procurement, without which several countries, not at least the smaller countries, would have been left behind as well. And now we see that this rollout is really scaling up. But I'm looking obviously at a pan-European perspective. And that's why it's very important to remember the pan-European solidarity, and that the EU can never be safe without other countries not being safe, be it the Balkan, the Eastern Partnership countries. And for this, I would like to express appreciation to the countries which are donating and or reselling vaccines, particularly still to countries where not all healthcare workers and the elderly people have been vaccinated. Thank you.
And we have Dr. Benish online. Dr. Benish, can you please just give us a sign if you want to add anything to this answer? Okay, go ahead.
Yes, Luba. I think that what has already been mentioned by regional director in the introductory words is that we still have an unfinished agenda in terms of vaccination. First, by reaching to those who need the vaccines most to prevent hospitalization, to prevent deaths, to prevent serious disease. And therefore, it's really important to have a broader perspective beyond the situation in a group of countries. And we really need to think about reaching those who are most vulnerable. And from this perspective, the solidarity is a key, and countries acting jointly and also supporting each other is really crucial. Thank you.
Thank you very much. Thanks a lot.
And
Dr. Smallwood?
Yeah,
Yes,
just to add that many countries have already announced preliminary figures for deaths averted, and that's the real measure that we're looking at in terms of the impact of the vaccination rollout so far. Here at the WHO European region, we're also conducting a preliminary analysis using a standard procedure that we use for influenza to measure the impact of influenza vaccines, to do a pan-European analysis of the deaths averted, and we'll be ready to share those results as soon as we have finalized them.
Okay, we have two. Yeah, let me just take two more questions sent in advance, and then we go online. Just bear with me. One question is from Camille Bavoler from Agence France Presse Global. Camille would like to ask the following questions. Cases are increasing in London, Baku, and St. Petersburg, where games are set to be played. How safe it is for 30,000 up to 60,000 football fans to gather in one arena in those cities? To what extent does the tournament prevent us to keep the virus under control? Yes, thank you very much, Camille. Dr. Smallwood, can you please take that question?
Thank you, Luba. And we've been raising awareness and key messaging around large mass gatherings. What we know is that in a context of increasing transmission, large mass gatherings can act as amplifiers in terms of transmission within the wider communities. And it's really important that there's a continuous public health risk assessment that's implemented by local authorities and the public health authorities around those mass gatherings. At the moment, of course, we have a large, major sporting tournament. High visibility is placed on that. We're seeing a lot of images, and there's a lot of images within the stadia. We need to look much beyond just the stadia themselves. What we need to look at is around the stadia. How are people getting there? Are they traveling in large, crowded convoys of buses? Are they taking individual measures when they're doing that? What's happening after the games when people leave the stadiums? Are they going into crowded bars and pubs to watch the matches? And we've said that should these things, this mixing happen, there will be cases. Because if this mixing is happening among people who are not fully vaccinated and there is the presence of the virus, there will be cases. And we've seen recent announcements, particularly from our colleagues in Scotland, with an exceptional analysis of the cases that they've detected in association with the football games. But this is not unexpected. And these types of events are happening all around the region, all around the world, in much smaller, less visible instances. And it's these small introductions, these continuous events that are happening that are driving the spread of the virus. So we need to look a little bit broader than the stadia themselves.
Thank you very much, Dr. Smallwood. Actually, it would be good to hear Dr. Kluge's opinion. And actually, the next question will give this opportunity. Actually, we have it from Riccardo Bagnato from Radio Televisione Svizzera. And Ricardo is asking very close question. He's asking, holding European Championships semi-finals and finals in London are, according to many epidemiologists, might be a major risk for the Delta variant diffusing in the UK and Europe. Do you share this opinion, Dr. Kluge?
It's very much in line with the previous question indeed, and Katie's reply. So yes, of course, we are definitely concerned. We know the Delta variant is documented, reported by a total of 33 countries out of the 53 in our WHO European region, including host countries of the UEFA Euro 2020. And as we heard from Katie, from Dr. Smallwood, that in some host cities where the matches will and are being held as well. So it comes back to the same piece of advice, really, that this has to be really, the risk has to be very well assessed, and people have to do it safely, taking care of the individual behavior, as we were telling, watching of the distance, wearing the masks, washing the hands, and really the health system to be further strengthened in the wake of the Delta variant with testing, increased testing, contact tracing, isolation, and genomic sequencing, which we have been telling since the beginning of the pandemic. And that's good news, that we know what can be done, but we're still not out of the woods.
Thank you to both of you. And now we move on with the questions raised online. I see Tom Magner from Carriers World Life. Tom, can you hear us? Please unmute your mic.
I can, Luba, and thank you very much. It's good to be on this press conference again. Dr. Kluge, our unpaid care reviewers will be heartened, certainly, by your advice earlier on. But the UK press and politicians no longer speak of shielding, yet many people remain vulnerable despite double vaccination. The majority of these unpaid carers work to support their families, yet are being forced back to the office. The UK government is intent on lifting all restrictions, come what may, and it appears that the wider UK population is ill-disciplined. What should the vulnerable do in the face of all this, and can employers work sympathetically with unpaid carers? Thank you.
As you may know, Tom, I have been establishing 8 months ago the Pan-European Commission on Health and Sustainable Development, chaired by Professor Mario Monti, to rethink policy priorities in the light of pandemics. We also have people from the UK, as Professor Martin McKee, Professor Mosialos, Jim O'Neill, and one of the recommendations coming forward is really on the health workforce, including the unpaid workers, the informal carers as well. And this is definitely a point of attention in our policies. On what needs to be done, Tom, sometimes I call it VIP approach, the V from variants. Genomic sequencing, strengthening the system, the I from immunization. And this is the best thing to do. We used to tell that the vaccine is a tool in the toolbox to get to a sustained transmission, but now it has become really the tool. And then the P from the people. That's why in the office here we established since a while the Behavioral Insights Unit to help countries with understanding what drives people to make a healthy or unhealthy decision, and then to design specific interventions for specific layers of the population rather than blaming them. And the last P of the VIP approach you are hinting to is the big P of politics, and we have been advocating all along that political decisions have to be driven by science, public health and epidemiological data. Thank you.
Thank you, Dr. Kluge. Next, Jamie Keaton from Associated Press. Jamie, can you unmute yourself?
Thank you, Luba, and thank you, Dr. Kluge and Dr. Smallwood. Nice to see you all again. I have two questions. The first is, it sort of echoes what has been said already, but your 3 points about things that need to be done lead me to believe that that that's more of a call for the public to respond more than governments. And I'd love it if you could, we see countries like France that are reopening. We see Turkey that's encouraging people to visit for tourism and whatnot. So what is your message directly to governments? Should they be doing more, because you do mention, the easing of social restrictions? Should they be holding back on that? And then the second question very quickly is, what do you say to people who wonder whether European countries should be sharing doses of vaccine when a new wave could be looming? How do countries strike the right balance on that? Thank you so much.
Thank you, Jamie. And I will start and then give to Katie. So the message to the governments is first and foremost to look from a pan-European perspective. We need coherence in policy. That's very important. And this goes from COVID-19 certificates to testing policies at the points of entry in countries. So that has been improving a lot, but coherence in policy is very important. And the second thing links to your second point is on the pan-European solidarity for vaccination. So this is indeed being studied also about the booster and whether it is needed for vulnerable people first and then the larger population. But I would say, let's work first on the 64% of the population in the pan-European region who has not received a single dose. Then if you look towards inside the country, for the governments, it is to respect science. That's my main message. We need to restore the trust in science because we know what needs to be done. I also know that decisions have to be based on pragmatism, that we can no longer have very long complete lockdowns and leaving the people alone. But we know enough now to extinguish the fires locally. So a strong surveillance system and act very fast on localized outbreaks, which will be there for quite a time to come.
Dr. Smallwood, do you want to add anything?
Yeah,
please go ahead.
Thank you. Just to add to the regional director, we've spoken many times about windows of opportunity, and I think we have one again in front of us. Many countries in the European region are still seeing very low incidence at the moment. That's a really good thing. Some countries are not. Some countries are seeing the highest death rates on a daily basis that they've seen during the whole pandemic. And that's really due to the rapid resurgence that is associated with the spread of the Delta variant. So there are 6 things, I think, that we really need to be clear about for our member states and for governments. One is, don't lift social measures in a context of increasing transmission. If you do lift social measures at all, make sure that that's complemented by reinforcing the public health measures that are in place. What does that mean? It means expanding sequencing, sharing sequencing data, using it for public health action, sharing knowledge on new variants as it happens with WHO and with other countries so that collectively we can improve our responses. It means continue to invest in testing. Don't let that run by the wayside just because cases may be lower than they were before. Remove any barriers to testing, especially financial barriers to testing. Expand incentives for people to quarantine and isolate if they need to. This is really important. And use the moment of low incidence to really strengthen your contact tracing and your case investigation. Countries like Scotland that have just announced really rapid analyses of where people are getting infected and where infections are spreading show a significant control over their health information. That enables them to take strategic, targeted, and swift action. And finally, vaccinate, vaccinate, vaccinate if you have the vaccine. If you have the vaccine, reach out, get to all of those priority groups, because that will mean that even if there is a surge in cases, that your most at-risk groups will be spared from hospitalization and death.
Thank you to both of you. Jimmy, I see your hands is still up. Do you need a clarification? Or?
Oh, that's okay. Thank you so much.
Okay. Then we have Ricardo Bagnato. Ricardo, I'm sorry, but we've got your questions in writing first. We are actually half an hour from the end, so we can go back to you in the next round of questions. So I take the next one, Gerardo D'Amico from Rai News 24 Italy. Gerardo, please go ahead.
Yes, thank you for the opportunity. I would like to know if the Green Pass could become a danger by favoring a greater spread of infection if not done with 2 doses and if it includes vaccines not recognized by the EMA. And more, I would like to know your judge about the decision to have football matches played in the city with a high number of infection.
Okay, thank you very much, Gerardo. Dr. Smallwood?
Thank you for the question, Gerardo. I think by the Green Pass, you mean the European Union's COVID-19 certificate that is bringing data together for individuals around testing status, immunity status from previous infection, and also vaccination status. This doesn't change what people are required to do as they travel internationally between countries in the European region. However, it does bring together the information and allows it to be put into a single application where countries still make their own decisions in terms of restrictions from specific countries or requirements on entry into their countries. So it brings together information. In terms of the football matches, of course, as the regional director, and I've said in the past, we are of course worried about large gatherings of people, especially if they're in settings where the virus is spreading quickly. This is a public health concern, and we encourage member states, local authorities, organisers of these events to take all measures needed to reduce the level of risk. There is no zero risk. There will always be a latent risk associated with these types of events. WHO has published a tool recently, specifically for the UEFA Euro 2020 matches, that provides information both on the stadia, the capacities, the measures that are in place at the local level, but also at the very local municipal level, the infection data that we have that's available publicly. And it enables organisers, the public, to look into where the matches are occurring and to understand the transmission dynamics and to use that information in their own risk assessments. So we encourage people to use that as much as possible.
Thank you. I'm looking at the next...
Excuse me, and about the football match in the city with a high number of infection. Thank you.
Anything to clarify?
I think I spoke about that at the beginning of my response, that in where cases are rising, risk assessments and mitigation measures need to be in place in those settings to avoid people from transmitting the virus. And in my previous answers to other questions, I think what needs to be highlighted is that there's not an exclusive focus on the stadium itself, that it's a broader assessment that needs to take into account the measures and the restrictions and the public health response in the community, in the host venues, much more broadly than just the stadia.
Okay, thank you very much. I hope this clarifies. And the next on the list is Emin Aliyev. Emin, I guess you couldn't put your full name in the Zoom ID, so I'm reading it from the chat that you posted to us. Emin Aliyev from Report News Agency in Baku, Azerbaijan. Emin, go ahead.
Hello?
Yes, go ahead, Emin. Yes, we can hear you.
Good afternoon, Mr. Kluge. Good afternoon, dear experts. Thank you for having me. My question is about my country. As our neighbors, Georgia and Russia, have recently reported that they have been recording the cases of Delta and Delta Plus strains of COVID-19 So my question is about the risks of spread of the Delta and Delta Plus in the South Caucasus region. And as you know, how do you assess the risks of the spread of these strains in our region? And as you know, the Azerbaijan, our country, has been vaccinating population against COVID-19. Do you think that the vaccination can help prevent the spread of these two strains, Delta and Delta Plus, in our country? And do you think that with a full vaccination of population, will we need a complete closure of the lockdown of the country again if these strains reach our country?
Okay, thank you very much, Emin. Dr. Smallwood, can you start?
Yes, I can start, and maybe my colleague Oleg would like to say something about vaccination uptake in Azerbaijan. In terms of the risk of spread or the likelihood of spread of Delta into the South Caucasus, we would currently state that as very high likelihood. What we're seeing is rapid replacement of other variants by Delta across the region, in Western European countries, in Russia, in several countries in Central Europe, and we're likely to see that occurring also in Central Asia, but also in the South Caucasus. So that is likely to be very high, and countries should be preparing for that right now. In Azerbaijan, there's been a very solid response to surges in the past, and that needs to be continued. So despite vaccination continuing or starting to occur with uptake increasing, there will remain large population groups, especially of people who are at risk of severe COVID-19, that will be those that are especially at risk as the Delta variant spreads. And it's really increasing vaccination uptake in those priority groups that is a key action here, but also the ability for Azerbaijan to take rapid, swift action to any increases in COVID-19 transmission, especially right now as incidence is relatively low compared to earlier this year.
Thank you. Dr. Danish online, can you add anything on vaccines in Azerbaijan? Probably a couple of important messages. If yes, please connect.
Can I just add before Oleg that
sure.
I forgot to say that it's really important that with the data that we have right now for the Delta virus, that people complete their vaccination course. We have good evidence now on 2 vaccine products that there's a drop in efficacy after a single dose, or a drop in effectiveness after a single dose. But the change after 2 doses of the vaccine is much less significant. So 2 doses of the vaccine will offer very similar levels of protection, but 1 dose will have a drop in efficacy.
Okay. Dr.
Thank
Danish?
you.
Yeah.
What I would like to highlight is that indeed in Azerbaijan, we see a very strong commitment from the national authorities to support immunization. And at this stage, more than 20% of population already has received first dose, which is an important achievement as compared to other middle-income countries. And also we saw the efforts of the government to bring various products and to offer citizens a choice to be vaccinated. With that said, we also have some concerns. First, to reach those who need it at most to get the vaccines. And when we look at vaccination coverage in elderly groups, in those who would really benefit most from vaccination, we see that there is a lot of room for further improvement. Second, we also noted some concerns amongst population related to use of specific products. So some vaccines might be in more demand, others in less demand. And from this perspective, the message from WHO is that all the products which have been authorized by WHO are safe and effective. And this needs to be communicated to everyone so that we don't have a situation when vaccines stay in the fridge and people remain unprotected. Vaccines will work really if they are administered, if they are given to people. And it's really very important that we support people with data, information to make them fully confident on the importance and need of vaccination. Unfortunately, we still have these concerns across various countries in the region, and we see some slowdown in coverage, in particular with some vaccines. So those are areas for further joint efforts, and we would be glad to work together on this. Thank you.
Thank you very much, Dr. Benes. Now is it Nikolai Skudsgaard from Reuters. Nikolai, can you unmute yourself?
Yes, hello, can you hear me?
Yes, very well, go ahead.
Good. Thanks for taking my questions. Dr. Kluge, are you concerned that the Euro Soccer Championships risk actually becoming or being a super spreader event? There's been reports of soccer fans bringing home the virus from matches abroad, and also in the UK, a lot of Scottish fans brought home the virus after a trip to London. And secondly, today is the launch of the new travel certificate. To put it directly, do you think people should be going on holiday in other countries in Europe? Thanks.
Yes, Dr. Kluge, go ahead. The most popular questions.
Thank you, Nikolai. I will kickstart and then ask Katie to complement. On the first question, I hope not, Nikolai, but this cannot be excluded on the reason that you are mentioning. So hence, again, this risk assessment to be taken very, very seriously, particularly with the knowledge we have now on the increased transmissibility of the Delta variant and the Delta Plus. Having said that, it's not only the UEFA 2020. I mean, there are many other mass gatherings as well, like music festivals and other ones, or smaller ones. So it comes back to the summer sense, the common sense. We're not out of the woods. We know what needs to be done. First and foremost, everyone to take the 2 jabs. So this is number 1. And then on the second one, certainly everyone needs to rethink the purpose of the travel. We know that travel leads to increased mixing, interactions, larger gatherings. So it is inherent a risk that is being taken. Of course, this risk can be minimized, again, if people are vaccinated twice. But then what we have to be careful, Nikolai, is that in a situation that still half of the healthcare workers are not vaccinated, that we will take away from a pan-European perspective vaccines for the people who are most exposed, our heroes, which we should continue to applaud, from younger populations who go on a pure touristic business trip. Thank you.
Thank you very much, Dr. Kluge. We move on with Ricardo Bagnato. Ricardo, thank you very much for... sorry, I'm looking at Dr. Smallwood. I think she wanted to add something. Please go ahead. Sorry, Dr. Smallwood.
No problem. I just wanted to add on the examples that you cited about cases being detected associated with the UEFA Euro 2020. This is expected. This is what we have been speaking about for several weeks and months. And the main message here is that the public health systems need to be primed to be able to respond quickly if there are cases emerging from any mass gathering. And they need to be aware of those risks, and they need to be able to identify them and take rapid action. And yes, we have seen the Scotland announcements yesterday. They're taking rapid action. We've seen cases among Finnish football fans returning in quite significant numbers with high positivity rates. And these are things that have been picked up by national authorities and local authorities, and they're responding to them quickly. We need all of the host venues to be doing the same thing. And we need public health systems across the region to be looking at all gatherings that are occurring, whether they're small household gatherings, whether they're large mass gatherings, and be primed to know how to detect super spreading events where they happen.
Very important messages. Ricardo Bagnato. Thank you, Ricardo, for your patience. Go ahead.
Can you hear me?
Ricardo?
Hello? Hello, can you hear me?
Very well, go ahead.
Okay, thank you very much to everybody for this meeting, very shortly and fast. Many epidemiologists, Dr. Smallwood, have been underlying the fact that mass gatherings like semifinals and final in a country where Delta variant cases are increasing and the population has been through a major vaccination process yet not completed is the right environment, let's call it the perfect storm, for the virus to develop new variants resistant to actual vaccines. Would you share this worry? If yes, could you elaborate more? And again, you said the name of the vaccines is a little bit weak with one dose. Is by any chance AstraZeneca? And you can understand why I asked that.
Thanks for the question. Let me respond. We're not exclusively concerned about Delta variant. Of course, it's a concern because it has higher transmissibility. It's present not only in 1 or 2 countries across the region, it's present in a majority of the countries across the region, and it's doubling on a weekly basis in many of those countries. So it's spreading quickly. The main concern is increasing transmission of COVID-19, regardless of the variant. This is where we need to be extremely careful. When it comes to the mass gatherings that are occurring, they should be risk assessed. There needs to be strong involvement of public health authorities in those risk assessments, and all actions to mitigate the level of risk within the gatherings, outside of the gatherings, and in associated events that might be happening need to take place. In terms of vaccine effectiveness for the Delta variant, we have really strong and robust evidence on 2 vaccines. We don't have much more evidence from other vaccines. The vaccines that we have evidence for are the Pfizer vaccine and the AstraZeneca vaccine. The changes or the effectiveness is similar in both. Both vaccines show a drop in effectiveness after 1 dose and a catch-up after 2 doses. Both AstraZeneca and Pfizer provide excellent protection against Delta virus after 2 doses and provide extremely good protection against hospitalization even after 1 dose.
Thank you. And I think we are done with questions online, and we still have 10 minutes to go. So I'll turn back to the list of questions submitted in advance. Birgit Griego from WDR in Germany. Actually, she has one question on Delta virus. I think we've covered that a little bit, but maybe just to stress a few messages. How dangerous and infectious is the Delta virus, and what do you suppose? When will we see other mutations? Can they be even more infectious? Dr. Smallwood, can you please advise?
Thanks for that, and it made me realize I didn't respond fully to the previous question. So new variants will occur, for sure. New variants of concern will also occur as long as the virus is transmitting in a widespread nature among the human population. This is the basic principle of survival of the fittest. It's basic evolutionary biology. There are some certainties in this context. What we have is our countermeasures against that. We need to stop transmission or slow transmission as much as possible, and slow down that process of evolution. So yes, new variants may occur, and they will occur mostly in unvaccinated populations where the virus is transmitting rapidly between people. In terms of Delta virus, there are 3 components to consider. One is transmissibility. It's very clear that Delta is the most transmissible of the variants of concern that have been detected and identified and characterized to date. In terms of immune escape, we do have some concerns around loss of effectiveness after a single dose of vaccine. We're still learning from other vaccines, but we have good, robust data on two vaccines to date. The main message here is that 2 vaccinations are really critical to prevent infection. Thirdly, in terms of disease severity in people who are not vaccinated, there is preliminary evidence that there may be an increased risk of hospitalization with the Delta virus. So all of this means that, yes, we have a lot to worry about. We need to take the same measures that we've taken for all SARS-CoV-2 variants. Nothing really changes in the mode of transmission, but we're still learning, and we need member states to be sharing with us all of the data, the studies, and the new knowledge generated in the context of a variant that's rapidly spreading, so that we can really use this and leverage this information and knowledge to provide recommendations to member states.
Thank you, Dr. Smallwood. Kostas Davanis from ERT Greece. 2 questions from him, both on Delta, but actually I'll combine them in one and probably split it between the 2 panelists we have here. The one is for Dr. Smallwood, I guess. Can you give us more information about Delta Plus variant and how it's different from Delta variant? That's one. And the second part of the question, probably for Dr. Kluge, if you don't mind, what should traveling citizens for their holiday and host countries look out for in order to avoid the risk of new wave of pandemic because of the Delta variant specifically? Who wants to start? Dr. Kluge, do you want to start?
Yes. So whether Delta or not Delta, the principle remains the same, but the efforts have to be doubled because of the increased transmissibility and a little bit of a breakthrough after a first dose of vaccination. It comes back to the same principles, responsibilizing the people and at the same time the governments to prepare their public health systems to be able to pick up any outbreaks of the Delta variant and really to try to contain it as soon as possible, which also means on points of entry to put the necessary public health measures in place, taking into account the situation of origin from where the traveler is coming. So, a word of double caution, I would say here. Thank you.
Yes, and just to address the question around Delta Plus, for WHO, we've characterized the B16172 sublineage as the Delta variant of concern. And what people are calling Delta Plus is in fact the Delta virus with an additional mutation, which we would still consider to be the Delta virus. There's in fact a couple of additional mutations that are appearing. That's also normal with the evolution of the virus. But for the purposes of public health at the moment, we don't consider that necessarily to be dissociated from Delta. The measures are the same. We should be taking every action we can, whether it's Delta virus or with any additional mutations. We still need to take the same action.
Okay, very quickly, we have 5-6 minutes to go. Tom, I can see you online, but just taking a final question from Riccardo Bagnato from Radio Televisione Svizzera. Did you check the UEFA/UK safety protocols? See links before. Riccardo shared the link for the event. Is it enough to avoid the risk? And he's talking about the European Championship, of course. Katie, can you...
Yes, thank you for that. WHO provided our risk assessment tools to UEFA, who worked with the member states and the local organising committees to undertake risk assessments. WHO did not have any direct involvement and was not consulted specifically on those.
Good. Tom Magna, Caris World Life. Tom, go ahead.
Thank you again, Leo. But just to follow up to my first question, I just wonder whether the WHO has got any specific advice for people who medically can't take the vaccine. I think I'm not a medical person, but I think they're often referred to as people having immunosuppressed systems. Be grateful for some clarification and advice. Thank you.
Okay. Dr. Benish, can you please take the question?
Thank you for this question. There are currently very few contraindications for COVID vaccines. And of course, contraindications are product specific. And there is a flexibility here on how to address a particular situation in a particular patient. So with the current vaccines, most of the people would be eligible to receive vaccine and to be vaccinated. In a case of, for example, of an anaphylactic reaction, it's a very severe allergic reaction, then vaccination cannot be continued for a person. And in that case, non-medical interventions remain a priority for getting protected from infection, unless we reach very high coverage and we have, let's say, community protection against the disease.
Thank you, Dr. Benish. I think we are now done, and that concludes our today's briefing. Thank you, everybody, for participating. We will be sharing the video of Dr. Kluge's statement and the briefing in an hour online in about an hour. If you need additional follow-up, please don't hesitate to contact us by email at any time. And I want to mention that this is the last press briefing that we will be holding for several weeks. So I wish you all a healthy summer and see you again in August. Stay healthy and goodbye.